Hey everyone, my name is Andy Notice, and the special topic presentation I have for us today is the Transtheoretical Model of Change. As we go through our discussion, some of the goals that we have for this presentation. First is to take a look at the origins of the theory as well as its authors and how they came to form this theory. We're going to be talking about the basic components, specifically two really important elements of the theory. We're going to take a look at some of the sample research and literature on the theory. We're going to see how this theory applies to our clients, specifically as Practicum students, and beyond. And we're going to take a look at the ethical, cultural considerations regarding this theory. And finally, we're going to have just some sample questions that we can use for our virtual discussions later on in the week. So I want to start off with a personal reflection. My first group supervision was with myself, my supervisor, and I think 4 other interns at the time. And during our discussion, someone brought up the fact of, hey, shouldn't we ask the new guy, which was me, what his theory of change is? And everybody laughed, and I kind of freaked out because I'm like, what's the right answer here? And so they continued to move on in the discussion, and they never actually asked me for a response. But it got me thinking, like, what I have said, what is my personal theory of change? And then fast forward a couple weeks, and I come to this course where I have to choose a special topic presentation. And I chose the Transtheoretical Model of Change because I knew nothing about it. And I'm really glad that I did, because the information that I learned from this presentation, or for researching this presentation, really has helped me solidify my personal understanding of how people change. So before we get into the presentation, I would love for you to just take a minute and pause the video and just write down, what is your personal theory of how people change? And there are several things that could contribute to that. First off, it could be things that you've learned in your study, in this course, in this master's program. It could be your personal training outside of the program. It could also be your experience that you've had with a client while you're working in the program, or just your personal experience in general. And so whatever that may be, now's the time to take a moment, pause the video, grab something to write down with, and just write down a couple thoughts that you have about your personal theory about how people change. First, let's take a look at the creators of this Transtheoretical Model of Change. First up, we have Dr. James Pershanka, who was a professor at the University of Rhode Island. He has since passed away just recently. Then we have Dr. Carlos C. Di Clemente, a professor of psychology at the University of Maryland. And so this theory was created in 1977 by researching how people quit smoking. And since then, in the years following, they have done extensive research and have refined and have been able to empirically proven that this theory is valid and true. The creators of this theory have successfully created a theory that is supported by evidence-based research and is transferable across a wide variety of disciplines, theories, interventions, and lifestyles. So, what is the Transtheoretical Model of Change? The first thing that you notice is the name. It's a mouthful. Transtheoretical Theory of Change. It should be shown that sometimes they call it the model of change, and sometimes they call it the theory of change, but they're essentially talking about the same thing. In short form, we just say TTM. So, the first thing that you'll notice is first word, transtheoretical. And that transtheoretical means across theories. And so that means that TTM is a theory that goes beyond or transcends any specific psychological theory or modality. And it's a change that applies to basically anything. So when discussing the TTM and the problem that it solves, the first thing that we need to talk about is eclecticism, or the eclectic approach to counseling. Now what this means is you've probably learned by now that as you start your practicum as a counselor, we rarely choose one theory or modality when treating a client. Rather, we draw from different theories, or either psychodynamic or humanistic, or existential, behavioral, and then we choose elements of those theories that we think might apply to our client. That's basically eclecticism. So in order to create a universal theory of change that can incorporate a variety of sometimes widely differing origin theories and interventions, you have to consider two important aspects of integration. The first is called technical eclecticism, which is a collection of approaches and techniques without any underlying theory or framework. Excuse me. Which is, I think, what most of us do. We're going to take something from here, something from there, and apply it to a client, and hopefully it works. The second is theoretical integration. Now, this involves combining the ideas and concepts from different theories to create a framework. In this case, to understand how people change. Now, according to TTM creators, every psychological theory has two important things in common. The first is that they have a process for how people change. The second thing is they have interventions to help facilitate that change. For example, we'll say cognitive behaviorists believe that people change when they recognize and change their negative automatic thoughts and core beliefs. Now, the interventions they use to facilitate that change could be exposure therapy, it could be journaling, relaxation techniques. So the question becomes, how can we understand or quantify how people change, whether they're in therapy or outside of therapy, when we have such a wide variety of psychological theories and interventions? And that's when the transtheoretical theory or model of change comes in. So let's say, for example, you have a client that you're seeing, and you're using mindfulness meditation, cognitive restructuring, and the miracle question to help facilitate change within this client. Those interventions come from different theories, and they have different theories of change. So what TTM does is it provides a framework of how people change, where at different stages, any one of those specific interventions can be applied. And even though they're applied from different modalities, they still allow you to have a cohesive process of change. So now we go back to the first question that I asked you. When you think about your personal theory of change, a couple of questions to ask you about that. Is it tied to any specific theory or modality? The second question is, does that theory or modality have a specific theory of change? And if it does, how open is that modality to different modalities or different interventions when it comes to how people change? Is it exclusively it has to be done this way, or does it allow for the incorporation of other ideas and theories? You could just take a moment and pause and answer those questions, and then when you're done, I'll just restart the video. So the first important concept to understand is called the stages of change. And there are 5/6 stages of change. You can see them all on the screen here. You have pre-contemplation, contemplation, preparation, action, and maintenance. Those 5 were the original theory, and then termination was added later on as a way to kind of complete it or definitively complete the theory or the stages of change. So let's take a look at these individually. First up, we have pre-contemplation. Now, someone in the pre-contemplation stage might say, hey, everything is fine, I don't need to change. Pre-contemplation is when individuals are not planning to take any action to change themselves in the near future, typically the first 6 months. Now, this could be because they don't have enough information about the consequences of their actions or their inactions, or maybe they've tried to change before and they've failed and they feel that they're discouraged. As a result, they avoid thinking or talking about the risky behaviors. These individuals often seem resistant or unmotivated, which means they're not ready for change. They're in the pre-contemplation phase. Next up, we have the contemplation phase. In this phase, somebody might say, hey, you know what, maybe you're right. There may be a few things that I could do differently. In this stage, this is where individuals intend to change within the next 6 months. They understand the benefits of change, but they're also aware of the downsides, what they'll lose by changing. The struggle between the pros and the cons can lead to feeling stuck, and we can refer to this as chronic contemplation or behavioral procrastination. People in this stage are usually not ready for traditional programs that we often associate with change. Next up, we have preparation. Someone in this stage might say, so yeah, I think I want to make some changes in my life. Where do I get started? What if I begin by trying this? Preparation is the stage where people plan to take action in the near future, usually within the next month. They may have made important changes in the past year. Individuals in this stage often have a specific plan, such as they're going to join a gym or a health class, they're going to consult a counselor, they're going to discuss some things with their doctors, the goals that they might have. They may buy a self-help book. These individuals are the ones who should be encouraged to participate in these programs because they are ready for the next stage, which is action. In action, someone says, changes are happening, but wow, it sure requires a lot of effort. Now, it's important to note that traditional models of change view action as change. So either you're in action or you're not in action. Either you changed or you haven't. And so the beauty of the TTM model is that it actually rounds out the process, that there's much more involved to people changing rather than they did it or they didn't do it. So this stage is clearly observable. Many associate behavioral change with taking action. But again, this model shows that there's a much more when it comes to changing rather than just did you do it or did you not do it. For example, for smoking, they will say that simply reducing the number of cigarettes or switching to a low-tar option, previous models will say that that's not change. Either you're smoking or you're not smoking. Well, this model will say, yeah, that actually fits into the process of change, and it's really helpful to understand where the client is when it comes to where they are on the stages of change. Next up, we have maintenance. In this stage, someone will say, I could see a real difference, but there are times I'm tempted to slip back into my old ways. Maintenance is a stage where individuals work to avoid returning to their old habits. Although they experience fewer temptations to revert back to their previous behaviors, they don't use change strategies as often as those in the action stage. As a result, they become more confident that they can sustain the positive changes that they've made in their life. The final stage is termination. And again, it wasn't in the original theory, but in the termination stage, it's when you have no more desire to return back to your previous behavior. And your new behavior is completely ingrained into your identity. And some theorists view that until you reach the termination stage, it's common to slip back a stage or two or to have relapse. So once again, just to recap for the stages of change. Contemplation stage, the first stage, you're unaware that you need to change. Second stage, contemplation, you're beginning to think about the benefits of changing your behavior. In preparation stage, you've already started to take small actions to prepare yourself for taking the big action step. And action is when you actually make those changes to your behavior, and it's noticeable, those changes. 5 is maintenance, where you have adopted the habits and you've sustained these new behaviors over a period of time. And finally, 6, the termination stage, is when change is complete and there is little to no threat of you relapsing or returning back to your previous behavior. Now, when we look at this model, it's great and it's very simple, but what they found is that the actual change process is a little bit more messy than that, which leads us to the, the spiral model of TTM. And so in this model, it's a cyclical model indicating that achieving lasting behavioral change may require several cycles through the process. And as you engage with the model, you might experience being stuck at a specific step for months before moving forward, or you could be stumbling or relapsing or needing to restart the whole process again. So for example, when you start with the pre-contemplation phase at the bottom, even in the very beginning, people could refuse and never actually move to contemplation. Or let's say they get to pre-contemplation and they successfully move to contemplation and then to preparation. before they take the action, the major step, there is this possibility of abandonment. And so they could just say, hey, yeah, that step is too big for me, or I don't want to do it, or it's too much work, and they could fall off the chart and then have to start with pre-contemplation again. But this chart shows if they have successful intervention at that stage, they can actually move to action. And it's important to note that within this model, the spiral model specifically, that relapse is expected. It's expected that you're going to take 2 steps forward, 1 step back. You may be stuck at a phase for a stage for a certain time, and that is okay. That is expected. That is normal. Very few people move through the cycle once and it's complete. Often it'll take some time and some relapse in order for it to reach the termination stage and actually have it be a successful habit change in their life. So the first important element of the transtheoretical model of change is the stages of change. The next one is the process of change. And so in the process of change, there are 10 processes. And what they found is that in the processes of change, through all the studies that they have done with people in or outside of counseling, they found that there are 8 to 10 stages that are listed here that people go through the processes of change. Sorry, not stages, processes of change. The first 5 we have are experiential, and the second 5 that we have are behavioral. So to go through that, the first one is consciousness raising, also known as increased awareness. And basically someone at the stage will say, I recall information that people had given me about how to stop smoking. And they use that as an example because that's what the original authors started their research in. And so you have this idea of, yes, there's some things that could help me to change. It's on my conscious awareness of changing. Second, we have dramatic relief. This is also known as emotional arousal. So someone in this stage related to smoking might say they react emotionally to warnings about smoking cigarettes. So whether that be on the package themselves, whether it's through a television ad or a conversation that someone having about smoking or the negative aspects of smoking. Before it wouldn't bother them, but now they're actually aware of that and it's causing an emotional response within them. Third, we have environmental reevaluation, also known as social reappraisal. Someone at this stage might say, I consider the view that smoking can be harmful to the environment. And so they're reevaluating themselves saying, okay, smoking could be harmful for me, for my kids, for my family, for those around me, for the environment itself. And they start to acknowledge that there may be benefits to them changing their behaviors. Fourth, we have social liberation, also known as environmental opportunities. And so in this stage, the person will say, I find society changing in ways that make it easier for me to be a non-smoker. Whether that's going to the gas station and you no longer see cigarettes displayed openly, or it's the smoking ads that we see on cigarettes, or whether it's commercials for hypnosis or counseling, or the patch, or nicotine, or whatever replacement that may be. They're learning that society around them has resources that could help them and benefit them when it comes to making those changes. And finally, we have number 5, self-reevaluation. And so someone in that stage would say, my dependency on cigarettes makes me feel disappointed in myself. And so they recognize the negative aspects of it, but they recognize I actually want to change, and the fact that I haven't changed yet actually is putting this negative emotional pressure on them to change. So that's the first 5, which are the experiential aspects. And next we have 6 to 10, which are the behavioral ones. And so number 6 is stimulus control. And so in this stage, someone says, I will remove things from my home that remind me of smoking, whether it's the ashtray or whether it's the cigarettes or other things that if you have a certain chair or spot that you sit at to smoke at, they'll remove those things to help make change more possible. Number 7 is helping relationships, also known as supporting. And in this stage, someone will say, I have someone who listens when I need to talk about my smoking. And so leveraging support from those around you who want to help you change and leaning into that resource. Number 8 is counter conditioning, also known as substituting. And in this stage, the person says, I will find that doing other things with my hands is a good substitute for smoking. So whether that's getting like a fidget spinner or something to play with, or understanding that this is something that I need to control for myself so that I don't go to what I normally do, is substituting negative behaviors with healthy ones. Number 9 is reinforcement management. So that's also called rewarding. And so I will reward myself when I don't smoke. So for example, positive rewards to encourage the behavior, negative to discourage. So if I take the money that I would buy for cigarettes, put it in a jar, and if I don't buy any cigarettes for a week, I'll take that and buy something for myself or treat someone else. Using those reinforcement management to help you reward yourself for the movement towards positive change. And then we have self-liberation, also known as committing. And so that's manipulating the environment to encourage positive change, making the commitment to not smoke. And so that's the final stage that we have there. So again, the first 5 are experiential, and the last 5 are behavioral. And so we have these 5, 6 stages of change, and then the processes of change, and how do those fit together? And so this is a chart here that is kind of complicated, but the more you look at it, the better it'll help to understand that. So when you look at the top left corner, on the top axis you have stages of change, and on the side one you have processes of change. So let's say start with the changes. So within the first stage of change, pre-contemplation, you have the processes of consciousness raising, emotional arousal, self-reevaluation, and environmental reevaluation. So those are the processes that someone goes through when they're in the first stage of pre-contemplation. Then you move to contemplation, and you can add social liberation onto that. And those represent the emotional phases. And then you get to the behavioral process. So you have an emotional reaction to change, and now we're moving to what does that behavioral process look like? And then so you go to the stage of preparation in green, and then within that stage of preparation you can have self-liberation, counter-conditioning, stimulus control, helping relationships, and then when you get to the action stage you have reinforcement management. And so you see within every stage of change there are individual processes that the individual goes through, and this is one of the ways to help kind of put into visual context what that might look like. Next up we have ethics and culture. Before that, I just want to talk about research first of all. And so again, I mentioned before that there has been extensive research done on the transtheoretical model of change. And although it started with smoking cessation, they've also branched out that research to include other changes that people try to make in their life, including exercise, low-fat diets, alcohol abuse, weight control, condom use for HIV protection, organizational change, drug abuse, medical compliance, stress management, and more. And so over a wide variety of fields and disciplines and areas, they have applied this research and find that those stages and processes are actually valid. So when it comes to ethics and culture, we find that universality has shown that this model is valid across a variety of cultural diversities. That being said, they have noticed that the implications for how the studies have been done within a weird environment, which stands for white, educated, industrial, rich, democratic. And so 90% of the research has done within the Caucasian, North America, and Europe. And so in terms of cultural views of change or for future research, it would be helpful to have research done by either professional researchers or authors or participants that are outside of that weird context in other ethnicities and cultures around the world, just to bolster the universality and the applicability of the trans-theoretical model of change. So how does this apply, or how is this effective for us in our practicum, in our practicum counseling settings? So there are 8 implications for therapists. The first one is not all patients are in action. Again, traditional theories of change say that either you are changing or you're not. And so understanding, first of all, that there are 6 stages and patients could be any of those stages is a first step for us understanding our clients better when it comes to change. Second is realistic goals step by step. And so understanding that there are stages and there are processes. And so a realistic goal isn't for them to either change or not change, but simply to move to the next step. And how can us as therapists help them to move either to the next step in the process or the next stage in the process as well. Third is be gentle with pre-contemplators. Again, as I showed you on the spiral model, that's one of the most sensitive stages. And so an example could be using something like motivational interviewing to help clients understand the importance of change, specifically when they're in that pre-contemplation phase, rather than saying, you should be doing this, get them to come to that own realization of themselves. And so it's really important to be careful with those who are in the pre-contemplation stage. Fourth is to use stages as a guide. The stages help us to understand, again, that there's a process. It's not all or nothing. And so depending on where the client is, you can use that as a guide to how to get them to the next stage. Fifth, we have follow the client, don't mismatch. And so it's really important when we're working with clients to understand that we need them to let us know where they're at. And we need to not come in with preconceived ideas of where they're at or where they should be. But if we follow them, then we'll prevent mismatching and we'll probably have a better success in moving into the next stage in the process. Sixth is stage matches relationships and treatment of choice. And so the therapeutic relationship that we have with the client is very, very important. And so what that level is helps us how much we can encourage them or show them how to get to the next stage, and also indicate which treatment we want to use with them. 7, this is one of the most important ones, is to anticipate recycling. As I mentioned before, taking a step backwards or going through the process a few times before it actually sticks is really important. And so it's important for us to anticipate clients taking steps back and also helping to even anticipate that. So prepare them for that. So as they're going through the stages saying, hey, this is a place where you might fall back. How can we prevent that or work against that to make sure that you can be successful in this change that you're trying to make? 8 is to integrate readiness to change into treatment resources. And so again, not only understanding what stage they're at, but how ready they are to move to the next stage will also inform what kind of interventions or modalities we want to use with them. Some additional resources. And so there are a bunch of resources that are here. Some of them are PDFs, some of them are websites. I understand that the theoretical model of change is a lot to handle. And so if you want to take a moment to just look at some of those, I've tried to choose ones that are easy and clear to understand, specifically with someone who may be struggling with those concepts. And so take a look at those. Those are great resources, again, for our virtual discussion that is coming on later. And finally, discussion questions. So some of the things that we can consider in our discussions later this week is, how does TTM inform your theory of change, now that you have an understanding of what it is? That theory that you wrote down in the very beginning, does it enhance it? Does it contradict it? Is it something that will help you with your clients, or is it just too complicated, you're just going to ignore it? Second thing is, how is TTM relevant to a client you are currently working with in your practicum? I know myself, I can pick up a couple of clients as I was preparing this presentation, and I was like, oh, I need to understand what phase that they're in, what stage that they're in, and respect that, and that will inform how we work together and the interventions that I will use with them. And then finally, reflect on a change you've experienced in your personal life and identify which stage of change you are currently in. And I'll just say for myself, I got previously diagnosed as pre-diabetic, and so I went through a program to help me understand what that is and to make certain lifestyle changes that will hopefully not allow me to move into the diabetic phase. And as I was doing that in this process, I was like, oh, yes, I can see that there are certain elements where I've actually had to relapse, or I have recycled to start over again, or where action is easier, or where I'm not in the pre-contemplation phase because I don't really want to eat flax, you know. And so is there a personal change that you're trying to go through in your life that the TTM model will help you to understand where you're at and help you to move along to make that successful life change? So that is the Transtheoretical model of change. I want to thank you for being a part of the presentation, and I look forward to our discussions virtually in this coming week. So thank you.